Pain in the lower buttock, back of the thigh, knee, and lower leg can be caused by problems with the hamstring muscles. Watch the video to the end to learn the causes of this pain, muscle tests to identify muscle problems, exercises to relieve discomfort at home, and helpful tips for preventing recurrence. I'm Dr. Chernov. Enjoy watching. The hamstring muscle group consists of three muscles: the semitendinosus and semimembranosus, which are located closer to the inner thigh, and the biceps femoris, which consists of two heads, short and long, and is located closer to the outer thigh. These muscles are often simply called hamstrings. Superiorly, the semitendinosus, lying above the semimembranosus, attaches to the ischial tuberosity, and inferiorly, its tendon attaches to the tibial tuberosity. This tendon can be easily felt with the knee bent closer to the inner thigh near the knee. The semimembranosus muscle, lying beneath the semitendinosus, attaches superiorly to the ischial tuberosity and inferiorly to the posterolateral surface of the medial condyle of the tibia. The long head of the biceps femoris attaches superiorly to the ischial tuberosity. The short head lies deeper and attaches superiorly to the femur. Inferiorly, both heads of the biceps femoris join to form a common tendon and attach to the posterolateral surface of the head of the fibula. This tendon can also be easily felt closer to the lateral surface of the thigh near the knee. Specific areas of tension or trigger points located in the semitendinosus, semimembranosus, and biceps femoris muscles cause widespread characteristic pain from the gluteal fold area radiating down the back of the thigh, knee, and lower leg. Trigger points in the semitendinosus and semimembranosus muscles refer pain to the gluteal fold area, the posterior medial aspect of the thigh and the knee. Sometimes the pain can extend even lower to the lower leg. Trigger points in the biceps femoris cause pain that radiates from below to the posterior and posterolateral aspect of the knee joint, the upper leg, and up the back of the thigh to the gluteal fold area. The pain intensifies while sitting, walking, running, jumping, or cycling, and also interferes with sleep. Limping may occur while walking. The onset and persistence of pain can be caused by acute or repetitive strains or muscle injuries resulting from compression of the lower thigh, such as by the high front edge of a chair seat or while sitting on the toilet for long periods. In addition to strains, sudden strains of these muscles, such as when kicking a ball in soccer or learning to do the splits, can also cause problems. When sitting, pain can occur in the buttocks, upper hamstrings, and back of the knee. As a result, the person tends to frequently change position. Pain may also occur or worsen upon standing, especially after prolonged sitting with legs crossed. The pain intensifies when descending stairs or with sudden knee flexion, such as when squatting. People with tight and shortened hamstrings may experience a posterior displacement of the pelvic bone, leading to a flattening of the lumbar lordosis, a rounded back, and an excessive forward head tilt. This, in turn, can lead to damage to the quadratus lumborum, paraspinal, and neck muscles, potentially leading to headaches and even cerebrovascular accidents. Myofascial pain syndrome involving the hamstring muscles has been described, including in children. These muscles were the fourth most common trigger point. Hamstrings affected by trigger points significantly limit range of motion when flexing the leg at the hip. Muscle shortening is diagnosed if the leg, straightened at the knee, cannot be raised to 80 degrees above horizontal. Hamstring problems also include the inability to reach the toes while sitting with straight legs or while standing. To relieve pain at home, apply mechanical force to the hamstring muscles and then stretch them. To objectively evaluate the therapeutic exercises I suggest, bend your torso toward your legs while sitting or standing with straight legs, attempting to reach your feet with your hands. Clearly record how you've completed this test and then proceed to the exercises. Take a large massage foam roller or a 2-liter bottle filled with warm water. Sit on the floor and place the massage tool under the back of your thigh. Slowly massage the thigh of one leg for several minutes, periodically changing the angle of application. Slightly rotating the thigh inward will focus more on the semitendinosus and semimembranosus muscles. Slightly rotating the thigh outward will focus more on the biceps femoris. If you find an area of increased muscle tension and soreness, pause there for 15 to 30 seconds. Breathe smoothly and deeply through your nose, trying to relax the muscles. Using a large foam roller usually doesn't cause significant pain. Be sure to repeat this exercise on the other side. If you don't have very large thighs or have a long, large foam roller, you can work both legs at once, but the intensity of the mechanical action on the muscles will be less than when working one leg at a time. You can massage your hamstrings even more intensely using massage balls measuring 12 and 8 centimeters in diameter. Take a large massage ball and massage the back of your thigh again for several minutes. If you find a sore spot in the muscle, stop and apply pressure for 15 to 30 seconds. Pay particular attention to the typical trigger point locations, as well as the area where the muscles attach to the ischial tuberosity. This is where problem areas are most often found. Repeat the exercise on the other side. Using a small massage ball measuring 8 centimeters in diameter, you can massage your hamstrings even more intensely, but on the floor or near a wall, it will sink into the muscles, especially if you have larger thighs. Therefore, use the edge of a stable table or a wooden chair. Bend your knee so that your shin hangs down and slowly massage the back of your thigh for several minutes, first on one leg, then on the other. After the massage exercises, repeat the straight-legged bend test while sitting or standing. Measure your progress and be sure to share it in the comments. After massaging your hamstrings, gently stretch them. It's important to note that hamstrings typically don't stretch well without prior massage with a foam roller, bottle, or ball. Therefore, I always recommend performing exercises with massage tools before any muscle stretching. This will improve your muscle stretching and further protect you from torn ligaments or muscle and fascial tissue injuries during stretching. The primary function of all three hamstring muscles is to flex the leg at the knee, extend the thigh at the hip, and tilt the pelvis posteriorly with the lower limb held in place. These muscles can be stretched in any position that involves knee extension, hip flexion, or anterior pelvic tilt with the leg held in place. The simplest exercise for stretching the hamstrings is lying on your back. Extend one leg at the knee and bend it at the hip. Grasp your thigh, shin, or foot with your hands. A simpler version of this exercise can be performed using a yoga strap or loop. Place the strap on your foot and grasp the free ends of the strap with your hands. Hold the final position for 1 minute, feeling the stretch in your hamstrings. With every second or third exhalation, strive to deepen the position. Be sure to perform this exercise on the other side. A similar exercise can be performed standing. Place one leg on a high support, such as a sturdy chair or table, and straighten it at the knee. Grasp the edge of the table or the back of the chair with your hands and gently tilt your pelvis and torso forward. You can intensify the stretch by stretching your foot toward you. Hold the final position for 1 minute, maintaining deep breathing, and then repeat the exercise on the other side. You can perform a similar exercise on the floor. Place one leg on your knee and extend the other leg straight out in front of you. Pull the heel of your straight leg toward you and slowly lean your torso forward. If you can't place your hands on the floor in this position, use yoga props or thick books. You can stretch your hamstrings on both legs while seated. Straighten your legs in front of you. Pull your glutes up, sitting comfortably on your sit bones. Grab your shins or feet with your hands, or use a strap. Take a deep breath through your nose. Look up and push your lower back forward, deepening the arch in your lumbar spine. Exhale slowly and gently. Bend your torso toward your legs, feeling the stretch in your hamstrings. Repeat this sequence 2-3 more times, then hold the final position for 1 minute. Try to perform this exercise with a straight back. This will stretch your hamstrings more effectively than with a rounded back. You can further stretch these muscles in a pool or bath filled with warm water. A similar exercise can be performed standing. Place your feet together or hip width apart. As you exhale, bend your torso forward, keeping your back straight, and grasp your shins with your hands. Inhale through your nose, look ahead, and push your lower back forward. As you slowly exhale, lower your torso even lower toward your legs, using your arms to help you. Keeping your legs straight, aim to push your lower back forward as you inhale, pressing your lower ribs toward your thighs. Do 2 to 3 more repetitions of this dynamic exercise, then hold the static stretch for 1 minute. Yoga practice uses a number of even more challenging exercises that require special preparation but are very effective at stretching the hamstrings. After performing any stretching exercises, be sure to do a few cycles of active dynamic movements, either standing or lying down, that engage the hamstring muscles. A key aspect of successful treatment for hamstring problems is preventing acute or chronic muscle strain, which can occur, for example, when swimming front crawl, running, or cycling with a low seat, where the knees don't fully extend. When sitting for long periods, it's crucial to keep your feet stable and not let them float in the air. Use a special footrest to help elevate your hips above the front edge of the chair. When using a footrest, it's important to maintain proper knee and ankle flexion. Avoid placing your feet too close to the chair or resting your heels on the floor. Your knees should be bent more than 90 degrees. Your hands should rest comfortably between your thighs and the seat of the chair. This will prevent mechanical compression of the muscles. When sitting on the toilet, it's also important to use a special footrest. This will not only relieve pressure on the hamstrings, resulting in numbness and tingling, but also improve bowel movements. Long car trips should include cruise control and frequent stops, during which it's important to do short warm-ups and stretch the hamstring muscles. Hamstring problems are often combined with weak gluteus maximus muscles and trigger points in the quadriceps. You can watch detailed reviews of these and other muscles in this playlist. I'd be happy if you subscribe to my channel and share this video with your friends who have pain in the lower buttocks and back of the leg. Stay healthy and see you in the next videos.